Hey, this is Marty Stempniak, Senior Writer for Hospitals and Health Networks. I'm reporting from the American Hospital Association's 29th Annual Rural Healthcare Leadership Summit, and I'm joined today by Tim Putnam, President and CEO of Margaret Mary Health. Tim, thanks so much for being with me today.
Oh, glad to be here. The weather's great.
Yeah. Could you just start, how's your conference been so far? I understand you got a large contingent with you.
We do. We have 17 people from our hospital here. We've got 9 board members, an assistant that'll be with us. It's been interesting. It's been thought-provoking. There's been a lot of discussion going back and forth. So we've got a lot of people here. We actually have a quorum of the board, of course. So the new and exciting things that we see we'll be able to implement in our hospital pretty rapidly.
Tim, could you tell us a little about Margaret Mary Health for starters, just the area that it serves? And
Sure. We're in a community of about 6,500 people. Our service area is 25,000. We are a critical access hospital. We're in between Cincinnati and Indianapolis. It's actually one of the larger critical access hospitals. We had a presentation from folks from Cody, Wyoming, and a lot of the things they're doing are very similar. Radiation oncology, a large surgical volume, around a $90 million net revenue. So as far as critical access goes, we're a pretty good size, but we think we serve our community well by doing a lot of those things.
Tim, I understand one of the biggest factors that can lead to a community hospital closing or falling into disrepair is a disengaged board. Why do you suppose that is? Why can a disengaged board lead to that for a small hospital?
Well, I think a lot of the things that we're seeing is when the board of directors is focused on things that are in the rearview mirror, looking at the last quarter's financials, looking at some of the things that are in the details, and not looking at some of the changes that are really happening in healthcare that'll be long term. I think they lose sight of what the board needs to be doing. I mean, we really think that nurses, doctors need to focus on the patient and the moment in front of them. The management team needs to make sure they have the resources they need to for the next few weeks or months. The board needs to look a year, 5 years, 10 years down the road to see where the hospital needs to be going. And a lot of times when I talk to my peers, my colleagues, CEOs, the board's kind of in the weeds and being at a conference like this, looking at what the changes are, how we need to adapt to them, are vital to that. We've taken role in work-based healthcare delivery. We've been involved with an accountable care organization, Medicare Shared Savings Plan, transition from volume to value. We're looking at things we can do in the commercial market. All of those things you wouldn't do if you were just looking at your financials from month to month or doing some things what a lot of boards do. So that's what I think makes a difference, an engaged board. And also one of the things that's quite honestly, what happens in rural hospitals is the CEO turnover is just so high. I mean, CEOs, the average CEO turnover in rural hospitals, and I've seen different numbers out there, but I've seen lows as low for the mean CEO time frame is 3 years. So you look at any one point in time, the CEO is only going to be there for the next 18 months. So how can they look long term? How can they say where this hospital is going to be in 5 or 10 years? I think that's one of the things. That's why it's so important for the board to be engaged and be involved in that kind of decision making. Where do we need to be? Where do we need to move our organization? Whether that's being part of a system, staying independent, or being part of some of the advanced payment programs like we are with the ACO.
So what have you guys done at Margaret Mary Health to make sure your board is engaged? What's been the sort of secret ingredient?
There's a lot of things they've done. One, I've got a great board of directors. They're engaged. They're there for the right reasons. They're community leaders. They're people that want to see, and quite honestly, it was their family members and people generations back that founded the hospital. So there's a lot of pressure on them to continue that legacy. So I think it starts with good people that are there for the right reasons. The other thing is the education that we've gone through. We go through this at least once a year and sometimes twice a year, whether it's a regional or national education session with our board as a whole. And what are we learning in that? What do we see the direction of healthcare going? How are we able to look at what we're doing? Is that going to serve our community well to be able to make sure that the people in our community get good healthcare going forward? So if I were to say anything, it would be attend education events as a whole. That's what's moved us forward more than anything else. It's very difficult when, especially some of the folks here, they have a group of trustees, but only one or two attend an education conference. They see something that's really impactful, is really going to make a change, and they come back to their board and say, look, we need to pay attention to that. And the 8 that didn't attend the conference say, well, I don't think that's really the case. So it's different here. And it's very difficult to get traction and get anything moving. But at the end of this conference, our board will look at me and say, if they've seen something profound, they'll look at me and say, this is what we want to happen in Batesville, and you and your management team go out and do it. And that will happen at the end of the conference. And by the time they meet next month, I'll better have a plan that I can show the board, this is what we're going to do, and this is how we're going to make it happen. And this is what it will take to do it. And it'll lead to very robust discussion. So of anything, it's education that you attend as a group, as a board as a whole.
Great. Tim, thanks so much for being with me today.
Appreciate it. Thank you very much.